Hi, welcome to SGD 166, Kinesiology and Physiology, and today's discussion will be about joints and joint movement, which is in Chapter 2 from our textbook. Let's go ahead and get started. So today we're going to take a look at three basic types of joints: fibrous joints, cartilaginous joints, and synovial joints. And we'll go through and we're going to define these, and we'll take a look at some examples of them as well. Fibrous joints. They're held together with fibrous connective tissue, and just like you might think, they are made up of tiny fibers that you can see actually in the example given here under Syndesmosis Joint, where you can see they're little tiny fibers. They're all put together. They kind of almost look like a feather design. And it forms an interosseous membrane there. The other two types of fibrous joints besides the Syndesmosis joint, we have the Gomphosis joint, where here in the example where you can see the little handle or the cylindrical piece is down inside the block, right inside there. The block has a hole in it, and then that cylindrical piece fits down inside there, and it creates a joint around the cylinder. And then the suture joint, where you can see two pieces of the blocks, and there's this wavy or this variable line through there, and it creates a joint where those two pieces come together. And it's not a straight line. It looks like they're very, it's just very cut up and very uneven in there. So we have suture joints, Gomphosis joints, and then Syndesmosis joints. Suture joints, the first one here, you can see this is in our skull or our cranium. The joint is fused together, and it's actually an immovable joint. Normally when we think of joints, we think of them like in our elbow, where we have a joint there, but we can move the bones in our elbow. Well, suture joints are normally immovable joints that are found in our cranium, and they have this zigzag appearance. As you can see from the image here, inside of that zigzag, if you look under the top layer of bone there's this layer of cushion called periosteum, and then underneath that we have a layer of bone, and you can see that bone is not dense or thick all the way through. It's not solid all the way through. There are some, it looks like little holes and airways through there. We'll talk about those later in the semester. And then there's another layer of periosteum. So we have this layer of bone that protects our brain and our skull here, but these fused joints, this suture joint, what that does is when we're born, our cranium actually has some mobility to it. It's able to move a little bit to allow the head to come through the birth canal. And so it allows for just a little bit of movement, but after birth, then that suture joint is actually fused together over just a couple weeks or months. The Gomphosis joint, that also is an immovable joint, and here you can see an image of a tooth set inside of a gum, and above the gum we see the crown of the tooth. Below the gum we see the root of the tooth, and then you can see in the image underneath the gum there is more bone there, and so it's a very stable joint, and we want that to be stable when we're chewing. Whether you're chewing gum or you're eating something, you don't want your teeth to move around, and so this also is an immovable joint. Again, we don't want it moving like our elbow can move or our fingers can move, but it's just a peg-like structure. It fits into the socket there, and in surrounding the tooth, before it fits into the bone there, is a periodontal ligament, and that creates the joint there. And so that ligament is what holds the tooth and attaches it into the bone there, keeping it a secure, immovable connection there. And as the image says, the bone that surrounds the tooth is called alveolar bone. The Syndesmosis joint. This is capable of a little bit of movement. We say slight movement because there is a fiber in between there. Now we see the two bones, the radius and the ulna here, and in between those two, it's not just empty space and nerves and blood vessels. There actually is something that connects the ulna and the radius together, all the way down the length of those bones. It's an interosseous membrane, and it's just a fibrous connective tissue. It keeps these bones together, and what it does is it keeps them from separating, and it adds a little stability and strength to that bone. They're also found between our tibia and our fibula down in the lower part of our leg there. So keep in mind is that a joint doesn't always have to be where the end of a bone is connected to the end of another bone. It can also be where two bones are side by side, such as the radius and the ulna. Next we see cartilaginous joints. They're connected together with a cartilage-like connective tissue, usually found in the form of a fibrocartilaginous disc. And there are two types of cartilaginous discs. There are Synchondrosis joints and there are Symphysis joints. So the first example on the left, we have costal cartilage of the first rib here. So if we have costal cartilage there, then there is bone on either side of that, and the cartilage is connecting two bones together. That is a synchondrosis joint where the cartilage and the bone meet together. Then on the image on the right, we have a fibrocartilage disc there. That's a disc from our vertebrae, from our spine, and that is a symphysis joint there where the cartilage is in between the two discs. So we have synchondrosis joints and symphysis joints. So there's two different types there. And a synchondrosis joint, it also is an immovable joint. It cannot move, and again, we don't want it to. It's the joint, as an example, the joint between the first costal cartilage of a rib and the sternum. Here in the image on the left, the highlighted blue material is cartilage, and you can see where it connects a rib to the sternum. And there we have the costal cartilage right in between where the rib and the sternum are connected. Now, it's immovable, the joint is, but that cartilage is not hard like a bone. It's got a little bit of flexibility to that, and we want flexibility there for our lungs. When we take a deep breath and our lungs expand, they need to move a little bit and flex. So that costal cartilage actually allows for a little bit of flexibility. Also, if you're roughhousing, playing games, think about football players when one player tackles another player, and if we didn't have a little bit of flexibility there in our costal cartilage, then instead of flexing and bending, we actually might have more broken ribs, a broken sternum, things like that. But there is a limit to the amount of flexibility, so if you get hit hard enough, then yes, the ribs will break. But the idea is that under normal circumstances, there's just some flexibility in there. In game development, we don't really show the ribs, but we do show the result of that flexibility. For instance, when a player character takes a deep breath, we do want to see their torso expanding, their chest, as it gets just a little bit larger and then a little bit smaller as the player breathes in and breathes out. There should be a little bit of flexibility in the sternum there. All right, also we see a cutaway piece there on the image on the right where we see some bone, and then there's a growth plate of the bone, and then we see the bone beneath that. And so anyway, so that's the synchondrosis joint. The symphysis joint here, they're slightly movable and located on the midline of the body. Now, the joints between the vertebrae here, they give us some flexibility and some movement. Think about this. We have all these joints, all these vertebrae, and if they each move just a little bit, then they allow us to have a lot of flexibility. So each one of them, if they move 1 degree, 2 degrees, then we'll be able to have a lot of flexibility, or even more than that. And then also another example of the symphysis joint is here's in the pelvis. We see the body of the pubic bone on the left and right sides, and then in between the pubic bone there is a symphysis joint in between there, and it's got just a little bit of cartilage in between there, and again that allows for a little bit of flexibility. Again, thinking about all the times that we may need flexibility in our pelvis. Again, playing games. One football player tackles another, and we don't want the pelvis breaking, we just want it to flex a little bit to allow for to allow for that motion. So there's that cartilage that's in between there. So again, flexibility is important. Our bodies are made this way to allow for movement and to allow for a little bit of flexibility. Next we come to synovial joints. Synovial joints are movable joints, and they have a protective coating of articular cartilage to reduce friction and minimize wear and tear. They're also encapsulated in an outer layer of fibrous tissue and an inner layer called the synovial membrane. Synovial membrane contains synovial fluid, which functions as a lubricant for the joint. The entire structure is called the joint capsule, and joint capsules are found only at the synovial joints. So the synovial joint we'll take a look at is it's a protective joint that's going to protect it from wear and tear. Think about all the different joints in your body that get a lot of motion that may need synovial joints to reduce friction, minimize wear and tear. One that comes to mind right away is my shoulder joint. My shoulder joint is always moving. It always has some movement going on because we use our arms all the time in our daily lives, and so that would be a really good place for a synovial joint. All right, there's different types of synovial joints. We're going to look at the ball and socket. We're going to look at the hinge joint, the pivot joint, the saddle joint, the gliding plane joint, and then the ellipsoid condyloid joint. So let's take a look at these. All right, first of all, the ball and socket joint. This is a sphere-like structure that fits into a cup-like structure. And some examples of this are going to be our shoulder joint. Remember, I just mentioned that our shoulder joint would be a great place for a synovial joint to minimize friction and minimize wear and tear because we use it so frequently. And then another example would be our hip joint, where we have a ball and socket joint where our femur goes into our pelvis there. So it's just to kind of make it easy, ball and socket, it's because that's the visual that it represents. The next one is a hinge joint. So the hinge joint has limited movement, unlike that ball and socket joint. The ball and socket joint, if you'll notice, let me go back, allows for a lot of movement because it can roll all around, and it's not just in one direction. It can pretty much move in just any direction 360 degrees. We'll take a look at limits later when we get into ligaments and things like that. All right, hinge joints, limited movement. The bone really only moves in one direction. Think about it. Your elbow only moves in one direction. If you make a fist with your hand and then make a muscle with your bicep, bring your arm up, and you think about that, I can only move in one direction, either up or down. If I try to move my hand down, that movement actually comes from my shoulder, not from my elbow. So the elbow joint is a hinge joint that only moves in one direction. Another example of that would be the knee joint. So here we see the image. In a hinge joint, a convex surface on one bone fits into a concave surface on another bone. Next, we have a pivot joint. The pivot joint swivels a bone on its own axis, as if, an example of this is as if you were shaking your head no. So when you shake your head no, it's rotating on a surface here. So as the image shows, in a pivot joint, the rounded end of one bone rotates within a ring-like structure formed by another bone or a ligament. So think about that little cylinder piece there. If it's just rotating, then the top bigger cylinder piece is kind of rubbing against it or gliding or sliding against it. But actually, because it's rotating around an axis, it's pivoting. So it's a bone pivoting on its own axis, and we say that that is a pivot joint. All right, next is a saddle joint. So a saddle joint has slightly more movement than a hinge joint. An example of this is the thumb joint. It has a concave and convex articulation like Pringles potato chips. If you've ever taken those and kind of switched them around and put one on, flipped the top one over and put it on top of the bottom one, you'll see that you can, the shape tends to go back and forth in both directions, north and south, and then also east and west. And so in a saddle joint, the two articulating ends of bones are shaped somewhat like saddles with convex and concave surfaces, and they're positioned perpendicularly one over top the other. So it makes for some good movement there. So keep in mind our thumb has that concave and convex articulation there, allowing us to have plenty of movement in many different directions with our thumb. Because we use our thumb for grasping, we use it for pressing. It needs the strength, but it also needs the movement, and that saddle joint is perfect for being inside our thumb. Next is a gliding or plane joint. Now this has the least movement of all synovial joints. One thing to remember about joints is usually the less movement of a joint, the more stable a joint is, and vice versa. The less stable a joint is, then the more movement it's going to have. And so they're kind of a trade-off, or there's a balance between movement and stability. So if there's least movement of all synovial joints here, then this must be the most stable joint. So the bones glide against each other. Examples of this will be in our carpal and tarsal joints, our pelvis, the ribs, and the vertebral column. Here you can see in the image, in a gliding joint, two bones with flat or slightly curved surfaces glide across each other. And so what happens is instead of rotating, pivoting, they're just sliding or gliding across one another here. So that's why it's called a gliding joint. And as you can see, it's also called a plane joint because it's gliding across a planar surface. So this is called a gliding or plane joint. The next one, the ellipsoid or condyloid joint. This is similar to a ball and socket, as you can see, but it's not quite a ball. And so even though there is a little bit of a socket there, it's not quite that ball. And so it's more of an ellipsoid. So it's similar to a ball and socket, but the surface is more oval than round. An example of this would be our wrist joints, our knuckles of the hand. And what happens is there's a little bit of gliding and sliding movement here than just rotating movement like the ball and socket. And so it's kind of in our knuckles of our hand. If you see when you make a fist and your knuckles are formed there, and then you open your hand, your finger is actually sliding against that to make this movement. Now it's very limited movement. I can only move my fingers about 90 degrees, maybe just a little bit more when I make a fist, because the rest of my hand is blocking it. So I can only go there, and then I can bring my fingers up about 90 degrees, and then maybe just a little bit more than that. So in an ellipsoid joint, the end of one bone, shaped like an elongated oval, fits into the elongated oval-shaped cavity of another bone. Alright, next we're going to talk about anatomical planes. There are three anatomical planes that we're going to discuss: sagittal planes, coronal or frontal planes, and then transverse planes. Let's take a look at sagittal. Here's the different planes and what they look like. They've been colored red, blue, and green so that you can see them easily. The sagittal plane has movements that are forward and backward movements of the head, spine, and limbs. So picture yourself nodding yes. When you move your head forward and backward, when you nod your head like that, you are moving in a sagittal plane. So keep that in mind. If you are to lift your leg up and forward, then if you were sitting and you were to lift your leg up, you would be moving also in a sagittal plane. The coronal plane is the plane that kind of divides the front and the back of our body. Movements in this plane are side-to-side movements of the head, neck, torso, and limbs. So think about if you were to take your ear and you were to try to move your head so that your ear would touch your shoulder, that is moving in the coronal plane. Also, if you were to take your arms and you put them at your side and then raise them outward to the left and the right, not in front of you, not in back of you, but to just, when they're at their side, move them up, that also is movement in the coronal plane. And then lastly, we have the transverse plane. And as you can see, the transverse plane cuts through the center, but it is a horizontal plane. So movements in this plane are rotations of the head, spine, and limbs. So if I were to take my head and I were to shake my head no, then I would be moving in the transverse plane. If I were to take my whole body and keep my feet planted in one direction, and I were to move my body to the left, or rotate it to the left, or rotate it to the right, then I would be moving in the transverse plane. So we have three different planes, anatomical planes: the sagittal plane, the coronal plane, and then the transverse plane. Next, we'll talk about joints of the skeleton. Here is an anterior view. Now, anterior means a front view or frontal view. I won't be naming all of the different joints that we see here, but I will just be pointing out some of the main ones. So, for instance, we see at the top the hinge joint, which is our TMJ, or temporomandibular joint. Then we also see a saddle joint, which is in the sternoclavicular joint. We see a gliding joint in the acromioclavicular joint. We also see a ball and socket joint. We mentioned that as our shoulder. It's also called the glenohumeral joint. Moving down, we'll see the pivot joint of the radio-ulnar joint. That's in our elbow. And then we also have gliding joints in our hands and wrist. And we also have a symphysis joint in our intervertebral disc joints. Moving down a little bit, we see another ball and socket joint in our femur and our pelvis. We have a hinge joint in our knee, and then we also have hinge joints in our ankle, and we also have gliding joints in our ankle as well, just depending on which part you're talking about. And then down in our toes, and also in our fingers, knuckles, we have these ellipsoid condyloid joints. In our fingers, they're metacarpophalangeal joints, or MCPs, or we have in our toes the metatarsophalangeal joints, which would be the MTPs. And so it's a lot easier to say MTP than metatarsophalangeal. So, and that would be the joint of the large toe there. Here's a posterior view. Posterior is the back side. And so here we'll take a look at some other joints from the back side. Here we can see the atlanto-occipital joint, which is an ellipsoid condyloid joint. We also see a ball and socket in the shoulder joint, which is our glenohumeral joint. And again, in the we see the gliding joint of the acromioclavicular joint. Moving down, the gliding joint, which is the costotransverse joint. We also have a gliding joint in the vertebral facet joints. And the elbow has the hinge joint, which is the humeral-ulnar joint. And in the wrist, the ellipsoid condyloid joint, which is a radiocarpal joint. Then down again, we can see the ball and socket joint of the hip. We see the modified hinge joint of the knee. And then a hinge joint in the ankle, which is the talocrural joint down there. So that's the posterior view of joints of the skeleton for main joints. Now let's go back up and take a look at our mandible. The mandible is the only movable joint in the cranium. If you'll remember earlier, we talked about those joints, the suture joint, where that is a joint in our cranium where our skull at one point was not quite fused together, but after a couple weeks or even a few months as a baby, they solidify and you can no longer move those joints in the cranium. So now the only movable joint in our cranium becomes the mandible or the jawbone. And so here we'll call it the mandible. The joint where the mandible is connected to our cranium, that is the TMJ or the temporomandibular joint. It is capable of three types of movement: depression and elevation. It's also capable of protraction, retraction, and then right and left deviation as well. So let me go over this just a moment. Depression and elevation. If you were to take your mouth and just simply open your mouth, that is depression. And then when you close your mouth, that's elevation. Protraction, if you were to take the lower part, your jaw, and if you were to try and protrude it outward and giving you an underbite, that would be protraction. And then when you take your mandible, your jaw, and you try and bring it back to give you either a normal bite or even an overbite, that would be retraction. And then we have right and left deviation when you take your jaw and move it from side to side. So each of those motions are created or made available to you by the mandible joint. Next, we have joints of the vertebral column. Here we have an occipital joint. Occipital pertains to the occipital region of the cranium. Atlanto pertains to the first cervical vertebra, which is known as the atlas. And then the axial pertains to the second cervical vertebra, which is known as the axis. Now the atlas and the axis are the only two specific named vertebra that we have. All the others are named C3, C4 for cervical, or they might be T1, T2 for thoracic, or they might be L1, L2, L3 for lumbar. Even though the C1 is the atlas and the C2 is the axis, they're still known as C1, C2, but they have specific names, atlas and the axis. And also, one more term, costo pertains to a rib. So we've already seen costocartilage, and that pertains to cartilage that is attached to the rib. All right, vertebral, some other terms here. Vertebral pertains to the body of a vertebra. Transverse pertains to the transverse processes of a vertebra. And lumbo pertains to the lumbar vertebrae. And sacral pertains to the sacrum bone. Here you can see the image of the joints that are highlighted in there. All right, here is a good picture of our C1 and C2, our atlas and our axis. And the joints in between those are called the atlanto-occipital and the atlanto-axial joints. Here we see a picture, the atlas vertebra and the occipital bone of the cranium down there kind of at the base of our skull, where it is sitting on top of the atlas. That's the atlanto-occipital joint. And then in between the atlas and the axis is the atlanto-axial joint. Joints are normally named by the two or more bones that they bring together. And so that's why we have the atlanto-axial, because that stands for atlas and axis. Next, we see flexion and extension of the head and neck at the cervical vertebral joints. Here's a good test right now, or a good quiz for you, a quick quiz, as which plane is the head bending in right now? So think about that. Which of the three planes is the head bending in? The transverse plane, the coronal plane? Let's see. So here we have the atlanto-occipital joint, is the joint between the occipital bone and the atlas C1. And then also the ellipsoid condyloid joint supports flexion and extension, rocking the head while saying yes. So if you don't know which plane this is moving in, then I would back up a little bit and kind of test yourself. And think about, as we talk about joints and movement, which plane would the joint be moving in? So that will help reinforce the planes. So here in the first picture on the left, we see flexion of the head. Flexion is where the head bends forward with the chin pulling in, and then extension of the head is where the head bends back with the chin pulling up. Try that motion now, and think to yourself as you move forward, flexion, and as you bend backward, extension. So flexion, extension. Here we have lateral movement, so it's lateral flexion of the head and neck, and usually lateral means side to side. So if I'm moving laterally, if I'm standing there and I move laterally, a game term would be I might be strafing. But because our head can't really strafe, we say that's lateral flexion of the head. So lateral movement is very similar to strafing in a first-person shooter game. So here we have lateral flexion of head and neck at the cervical vertebral joints. We have some gliding joint action here. So on the image on the left, we see a neutral position of the head and neck. And then when the head tries to touch the ear to the shoulder and move that direction, that is right lateral flexion. So the head and neck tilt toward the right shoulder. It can also tilt toward the left shoulder, and we would call that left lateral flexion. Next, with our head, we also have rotation of the head and neck at the cervical vertebral joints. So we're starting to get the picture here that we can have a lot of movement with our head. Here we have the atlantoaxial joint. It's the joint between the atlas and the axis, C1 and C2. And the pivot joint supports rotational movement as when we're saying no. Here, the image on the left, we see a neutral position, but then we also, on the image on the right, we see left rotation of the head and the neck from a posterior view. And the head and neck can also rotate toward the right. So now we're just rotating. So far, we've seen flexion and extension of the head moving forward and backward. We've seen lateral movement, and then we've also seen rotation. So our head and neck are able to have a lot of movement, which is good. So we can look all around, so we can do things and not have to always move our entire body. If you've ever done something to maybe a neck muscle or what we might say is thrown our neck out, something like that, and all of a sudden you can't really turn your head to look, you actually have to move your whole body. And if you've seen somebody that's done that before, it's pretty obvious because they move their whole body to turn and look at something. So that rotation of our head and neck actually is a pretty important feature, so we're not always having to move our entire body, we can just move a portion of it. And it's the same with game characters, is we need our game characters to actually have a lot of movement in the head and neck as well. So if I'm rigging a character, I want to make sure that there's plenty of forward-backward movement, there's plenty of lateral left and right movement, and there's also plenty of left and right rotation as well. And so we don't want to go too far. It would look unnatural to rotate the head too far. In fact, we can barely rotate our head 90 degrees to one direction. And so that when we're rigging a character, we would want to make sure to limit it to that specific amount of movement. All right, our next slide is joints of the rib cage. So we already said that costo or costal pertains to anything having to do with ribs. Vertebral pertains to the vertebrae, and then sterno pertains to the sternum or the breastbone. And then chondral pertains to cartilage. So if we have costochondral, that would be ribs and cartilage, has something to do with the ribs and cartilage. Some of the highlighted areas here in the image we see, the atlanto-occipital joint and the atlantoaxial joint. We see a costotransverse joint. We see a another costotransverse joint where the ribs are connected with the vertebrae. And then we see the rib cage, another costotransverse joint. We have a vertebral facet joint where the facets of the vertebrae come together, and where they are touching, that actually forms a joint there. And they'll slide, glide, or move along there. So not all joints have to rotate or pivot. Some of them just kind of slide against each other. Then we see the lumbosacral joint and the sacrum bone there at the very end. All right, our next slide is now, this shows the sternum, and we see joints of the rib cage and the sternum. The sternum has two joints. There is the manubriosternal joint and the xiphisternal joint. That XI is a Z sound, so it's a xiphisternal joint. And here we see with the rib cage, we have costovertebral joints. Remember, costo is anything having to do with the ribs. We see the manubriosternal joint, where the manubrium and the sternum come together. That's not one piece there where the sternum is. There's two pieces up there, and we see ribs can attach to both of them. The costochondral joint on the left, the sternum, the rib are being pointed out, the costochondral joints, where the ribs and the cartilage are coming together. And then we also see sternocostal joints, where the sternum and the rib comes together. And costal cartilage, interchondral joint, And then down at the very bottom, we see the xiphosternal joint there. That's where the xiphoid joint, or where the xiphoid and the sternum come together, and it creates that xiphosternal joint there. So those are the joints of the upper body, and that is the end of our discussion about joints. Thank you very much.